Are you seeing dots in your vision? They're these little black things which float around. Sometimes people notice them when they're looking at a bright background like a white sky or blue sky, and sometimes against a computer screen. Now, what are they? Is it something that we need to be worried about? How soon do I need to be seen by an optometrist? Well, this is what we're going to talk about in this video, so stay tuned. If you're new to the community, don't forget to hit subscribe and click that bell so you're kept up to date with the latest information and the newest videos that we create. With that being said, let's jump right into it. In this video, we're going to be talking about what floaters are, and if this is something that needs to be treated straight away, or is it something that you can actually wait before you're seen by a specialist. For your own specific situation, I'm going to be asking a series of questions that will allow you to be able to identify where you sit in that scale. There's a different video I've created for those people who want to know how to get rid of floaters or how to just start noticing them less. So I'll put the link up here for you and make your way there for those videos. So you might be seeing these black dots for the first time. So it can be quite worrying, it can be quite concerning, you might be feeling a little bit anxious, but that's okay. That's normal. A lot of people do get floaters. In my career, I think probably I've seen 60% of people having some kind of floaters. Some of them are visible to the person, some of them are visible only when an optometrist looks inside the eye. So they are very, very common. Now, the question to ask is, how quickly do I need to be seen by a health professional? How serious is my situation? What I want to do is give you a tool to help you to navigate around how quickly you need to be seen. So I call this the fine check. It's very simple, floaters in eye check. It's nothing complicated, but it's just something that I've just created to allow you to be able to ask yourself a series of questions, score yourself appropriately. There's a score of 5 or 10 associated to each of the questions that I'm going to ask you, and I want you to add those scores together. Have a calculator to hand or a pen and pencil, or you're just good at maths and you can do it all in your head. And at the end of this, I'm going to get you to add those numbers together, and that will give us a scale of it's not that urgent all the way to you really need to be seen right now. Okay, at this point I just want to put out there that this is for educational purposes only, and don't take this as gospel. This is from my own experience of being an optometrist for 20 years. So if you're unsure or have any doubt, please remember, pick up the phone, speak to your own health provider. They're the ones who will give you great advice, I'm sure. So the first question to ask yourself is, how many are you seeing? Are you seeing just one floater, or are you seeing more than one floater? If you're seeing just one floater, give yourself 5 points. If you're seeing more than one floater, give yourself 10 points. The second question to ask yourself is, when did they show up? Did they show up less than 2 weeks ago, or did they show up more than 2 weeks ago? If they showed up more than 2 weeks ago, then you give yourself 5 points. If they showed up just less than 2 weeks ago, give yourself 10 points. Now, number 3. Are there any other symptoms for each of these that you are getting? Give yourself 10 points. Have you noticed flashes? So little pinpricks of light, which either are little pinpricks or they shoot past your eye, corner of your eye typically, which is like representing lightning bolts. A lot of patients describe it as lightning, but some patients just only get little pinpricks of light. Please note, this is not the same as shimmering. Some people get shimmering in their vision, shimmering that lasts anywhere from 5 minutes to 30 minutes. That is different. That is a different scenario, and I'll probably create a different video for that. But for now, we're talking about pinpricks of light or flashing lightning bolts as they go up and down your vision. And to note, this also happens when your eyes are closed. So while your eyes are closed, if you're still seeing these bright, sharp things or pinpricks of light, then that's something to note. The next thing is floaters. If you're seeing lots and lots, hundreds of little black dots floating around in your vision there, that's super important as well. Give yourself 10 points as well for that. And the last one is, are you noticing a curtain that's coming over your vision? Any of those 3, you give yourself 10 points. If you got more than one of those, you give yourself 20 points if you got 2, or 30 points if you got all 3. Now the next question, which is question number 4, is where are they? Are they located centrally in the middle of your vision, or are they off to the sides? So if they're in the middle, give yourself 5 points. If they're off to the side, give yourself 10 points. Now, question number 5. What color are they? Are they red? In which case, give yourself 10 points. Or are they colorless? Are they translucent? Are they gray? Are they black? If they are like that, give yourself 5 points. Now, question number 6. What do they look like? Do they look like strands, or do they look like a spider or a fly in your vision? If so, give yourself 5 points. Do they look like cobwebs, or do they look like lots of little dots? If so, give yourself 10 points. We're at the end of our questions. I want you to just take a moment and just add those numbers up. Now, when you've added those numbers together, that should give you a range of scores. Some people will have a low score, some people will have a higher score. The range should be from about 25 to 80. If you're on the low end, if you've got 25, then that's something that we don't need to overly panic about at this very second. If you, on the contrast side to that, if you've got 80, then you need to actually be seen straight away. That's something that actually you do want to probably get looked at pretty much sooner rather than later. So what's the purpose of doing this? To give you an idea, if you're at 80, that's like same as going to hospital same day. If you're seeing flashes, floaters, a curtain, you're having red colored dots in your vision. So that's all stuff which are significant. So you do want to get seen that same day, either by your own health professional, if they're available on that day for you. If not, then you take yourself to an eye emergency somewhere that you can access. So hopefully this gives you a little bit more insight into how to look after your specific situation. So thank you very much, guys, and I hope that's really helped. So the next video I'm going to do for you is how to get rid of floaters naturally. How can we naturally get rid of floaters? Number of times that people have asked, or I've heard people ask their optometrist saying, I've got these floaters, what can I do about it? And they go, well, nothing. There's nothing you can do. It'll go away by itself. How many times have you heard that? Personally, I've heard that a lot. So this is something that you want to just know that there is something that you can do, and I'm going to share that in my next video. In the spirit of the community, I'd be really keen to hear your experiences with floaters. What's happened when you've actually called up and spoken to a receptionist and tried to book an appointment? Did they get you in straight away? Did they ask you these 6 questions or any questions? How quickly were you seen? And it'd be really interesting to know, what was the outcome? So what did they say those floaters actually were? So I hope that all of you are okay now, if any of you did have complications with your floaters. But again, put those comments and notes in those comments section so people can actually learn from experiences. So just the other day, I was sitting next to my wife watching TV, and she received a text from a friend. And in that text, the person said that they noticed a black dot floating around. And so when I asked, I go, is it actually floating? Is there a delay between when you move your eye and where that dot moves? Or is it moving exactly wherever you're fixating? At that point, he mentioned that there's no delay. It's most likely to do with something at the cornea, the lens, or the retina. And after having a couple of text messages forward and backwards, I told him he needs to be seen within the next day or two. So he picked up the phone, called his local optometrist, booked in, and since then I've heard back from him, and he says that it was actually a small lesion at the macula, a small swelling, which they're going to keep an eye on. So that, in this case, was not a floater, but it was a black dot floating in the vision. So these questions will help you to understand a little bit more about your own particular situation. But just remember, if there's a delay between the movement of your eye and the black dot, that is most likely something in the vitreous, which is what we call a floater. Thanks for joining me today. I hope you got something of value. Remember, stay optimistic, stay positive, and I look forward to seeing you on the next one.